Did you guys know that 1 in every 10 women will have PCOS? Hi guys, welcome back to Women's Den. My name is Lisa Snyder, and today we are going to talk about polycystic ovarian syndrome, or PCOS. I first found out I had PCOS when I was probably 20, 21, and I had went to the gynecologist because I was trying to look for something that can help with my painful periods. I was just about to start my internship, and I wanted something that could really help decrease the severity of my pain. So my gynecologist recommended birth control, and during my exam she tested me for PCOS because a lot of the symptoms I was telling her, she thought and felt like it could be polycystic ovarian syndrome. And I really, at that point in time when I was 20, 21, really didn't think much about it when I got the diagnosis. I only really started focusing my diet and what I'm putting into my body when my husband and I first got married and we were trying to have kids. What exactly is PCOS? PCOS is an endocrine disease. It causes hormonal imbalance. Women with PCOS tend to have infrequent menstrual cycles or irregular cycles. They tend to have cysts on their ovaries. Some people have excessive hair growth. Some people have hair loss. And how are you diagnosed with polycystic ovarian syndrome? They usually test you for 2 out of 3 symptoms. The first one is high androgen levels, and this is usually tested with blood. Mine came back slightly elevated, and with this it actually can lead to excessive hair growth, hair loss, high cholesterol, amongst other things. The second thing that they look at, the gynecologist looks at, is your period cycle or your menstrual cycle and the length of it. A normal period is usually between 21 and 35 days. My period, on the other hand, comes anywhere from 26 to 37 days, so it falls out of that range, not by much. Before, when I was younger, before I really started working on controlling my PCOS, it would range anywhere from 20 days to 56 days, and I actually have a log that I'm going to include in the video to show you just for this past year how varied my period is. The third thing that they look at is they usually do an ultrasound to look at your ovaries just to see how many follicles are in it. Here's an example of a normal ultrasound. Here's an example of an abnormal ultrasound or polycystic ovarian ovary. In other words, these follicles in this pretend ovary looks normal. The outside, the actual follicle all around, but this is what my ovary looks like. One of the main symptoms of PCOS is infertility, and this is something I found out early in my marriage. It was something that our gynecologist told us. Basically what happens is that the follicles in a PCO ovary basically does not get mature enough to get fertilized by sperm. So that was one of the things I learned about PCOS. So another thing I have dealt with is painful periods, and that's something I've been dealing with for the past 25 to 30 years, and I'll actually leave the link to a blog that I wrote about some of the things that I've tried to help me with my painful periods. I'll leave the description down, or the link down in the description below. Another thing I deal with is acne, adult acne, and with that I'll also leave the video at the end of this video so that way you can look at my at-home facial that I do for my acne. Again, I mentioned earlier, another thing that you deal with is either weight gain, excessive hair growth, and as of recently I've started going down the route of Eastern medicine. And I've been getting really great advice from Elizabeth Noble. She is the owner of Noble Natural Medicine, and she have been recommending a couple of medication that I'm going to be trying in the next few cycles. One of them is called Cramp Bark Plus, and I don't know if you can see that. And this is something that helps with stagnant blood, which is very common in women who have PCOS. So if you guys have any questions, any comments about PCOS, if you suffer from PCOS, please comment down below. Send me a message if you like. Follow us on Facebook and you can comment there. Having PCOS is not really fun. Painful periods is not fun, especially when you have to work and you're dealing with pain, and usually my pain extends down from my uterus all the way down to my knees, sometimes radiate into my back. So being at work, having my period is never fun. PCOS definitely gets more aggravated if I eat more dairy products or more sugar. If I eat a lot of sugary snacks, then my period is extremely painful that cycle. So I've been trying to really change my diet and trying to limit the amount of sugar I'm eating. So that actually helps. Again, I've been trying this Cramp Bark Plus, and I definitely recommend it so far. Usually towards the end of my period, I spot for probably about 5-6 days. With this, I've only spotted for 2-3 days, which has really helped a lot. I really appreciate the recommendation from Elizabeth Noble. And I'll try to leave a link to her website. Thank you guys for watching this video. Don't forget to look at our previous video. I'm going to include the link or the video for my do-it-yourself at-home facial for acne skin type. Below, I'm going to include the Mother's Day video, a tribute from some of our moderators here at Women's Den. Also, don't forget